I'm Dr. Masoud Moghaddam. I'm fellow with Royal Australian College of General Practitioners, and one of my special interests is chronic disease management. So basically, any medical condition in any field of the medicine which lasts more than 6 months and affects the patient's long-term health in any ways, that is considered as a chronic disease. And our goal as a GP, the first step is that to prevent this thing from happening with the preventive care. But when it is established and the patient has a chronic disease, basically to manage it in a way, in a very appropriate and very efficient way to decrease any kind of either physical, mental or financial burden in the long term. So it doesn't affect the patient's life expectancy or quality of the life in the future. For example, I had a patient that simply came to me as having a skin rash in part of the body, and basically as a GP I addressed that one, treated. But when I looked at the patients holistically, looking at this patient 18 years old having this rash, which was a fungal rash, it tricked me maybe something else is going on. So I did a simple BSL check for the patient. It means the blood sugar level, and the patient sugar was around 20. So the patient already starting to develop a diabetes type 1. So I basically tell the patient this is the possibility. We start you to have investigated, and probably you are developing diabetes type 1, which is basically insulin dependent, and we started the patient management from there. So this is not something that he could have avoided or anything prevented before. It was happening, but what is going to happen from now on for an 18 years old gentleman, it's going to affect his life. So proper management is very important. First is the diagnosis with a blood test, and I organized the patient to diagnose with the diabetes type 1. Then after the result, the patient was referred to endocrinologist, so for a further management of the diabetes. But the things doesn't end there. So as his GP, it's our job to basically organize a different preventive care in a different area which diabetes could affect. This could be the eye things, it could be the feet. So that's why we have the basically the services by the Medicare. We call it GP management plan or the team care arrangement, that we organize the long-term management plan and the team care for the patient to address this chronic disease without causing a significant burden for the patient. So the patient knows that, yes, for this problem my GP has organized, I see this particular person, this specialist, I'm seeing this person for the other problem and this one. So it makes things to go very smoothly, like a clock, that the patient knows every 3-4 months he needs to see this person, do this blood test and so on. So it becomes part of your life rather than being confused in the health system that for this, where should I go, or I do my own research, why should I be worried about? As a GP, we become the patient's basically advocate and organizing all these services.